The best possible care is clearly provided by any device that is more accurate, more precise, saves operating room time, saves anesthesia time, saves x-ray time, compared to what we've done in the past.
If you have a device that has the additional safety feature of reducing the risk of surgery at essentially no additional cost, I mean, it's a no-brainer.
As surgeons begin to use the IntelliSense Drill, there is a brief learning curve. It does require a little bit of retraining of your brain, but I certainly think that the more surgeons that get their hands on this drill, the more it's going to become the go-to drill.
It all began in April 2017 when a dog attacked me and I broke my leg. A metal plate was installed in my leg with 10 screws. Several weeks later, I developed blood clots, was put in the hospital. My leg wasn't getting better, it was getting worse.
When I walked in the room to see Jen, I'd already seen her x-rays, and when she pointed at the area that hurt, I knew right away what the problem was. I just rubbed my hand right over that spot, and I can feel the screws. They were long.
It's interesting because when we watched the x-rays, the surgeon had actually taken out the first longest screw and replaced it. But had the surgeon used the technology that Dr. McGinley has, I wouldn't have lost almost a year of my life, my quality of life.
I know our technology is making surgery safer for patients all around the world. I've seen it myself. We have surgeons that come up to us all the time and tell us their experience with this technology. We've seen it in real time where surgeons stop using x-rays, where the surgery's faster, where the screws are correct on the first go. That's new. That's groundbreaking medicine.
My favorite stories really are when you let the resident or fellow drill for the first time. And they're drilling, and they hear that first beep, and then they're on the second cortex, and you know what they're thinking. They're thinking, is this thing really going to stop? And then it goes to the second cortex, and it stops. And they look at you, and you can see it in their eyes. It's like a light bulb went off. It is unbelievable to see their faces. Like, where has this been my entire career?
This is one of those things that I think 10 years from now, no one's going to be drilling without it, because it doesn't make any sense. It doesn't make any sense to have a device that has incorporated safety features which prevent you from damaging a structure on the other side of the bone, and to go with old technology or established technology that has that risk.
It's a logical step forward, right? It's accepting it, which is taking some time. And I think it's because it's a new idea. It's innovative, it's different. And then people don't like to change from what they've done in the past. But if change is better, then people will change over time. And this is clearly a superior product to what we've done over the last 100 years.
I think the IntelliSense Drill is a great addition to skills and strategies that a surgeon already should be using for patient safety.
We're not looking to replace the surgeon. This is not a big $1 million robotic machine we're bringing into the operating room. This is something that's right in the surgeon's hands. So you still have that human factor. You still have the physician taking care of their patient in the operating room. But we're just using technology just like we use it in everyday life to improve what we do, to make it more efficient and to make our lives better.
Without Dr. McGinley, I would still be in pain. He was amazing. He knew exactly what to do. He knew exactly what was wrong. He knew exactly how to help me. Here I am today, much, much better, thanks to Dr. McGinley. Every orthopedic surgeon should be using this drill. Every single one of them should.
I think it's extremely important for patients to advocate for the drill. There's so many patients who are inadvertently injured by screws that are misplaced, too short or too long. And if there are enough of those patients that tell their stories, then people will realize there really is a better product.
If I were a patient and I knew that this technology was out there and my surgeon wasn't going to use it, that would be a problem for me.
If we can get this technology in the hands of all surgeons, that would mean our dream really was accomplished. What that would mean on a larger scale is that we change the practice of medicine, we change the standard of care. We made it safer. As physicians, that's what we strive to do. If this were my family, if this were my son, if this were my wife, if this were me, I would really want this technology being used.